We begin tonight here in Little Rock, Arkansas, 893 miles southwest of Washington, D.C. A long way both geographically and politically from our nation's capital. But I can tell you that what happened last night in D.C. shook the proverbial ground even here on the banks of the Arkansas River. This morning, I spoke at an event at the Clinton School of Public Service here in Little Rock. And before I took the stage, before I was even being introduced, Skip Rutherford, the dean of the school, said to the crowd that what had happened on Capitol Hill last night was an historic vote. What followed, to everybody's surprise, was the entire room at 9 a.m. on a Monday morning, roughly 1,000 people in Arkansas leaping to their feet and giving a thunderous, hollering, cheering, sustained standing ovation that went on and on and on. Not for any person, definitely not for me. It was for health reform passing the House. 1,000 people, all ages, all ethnicities, a very diverse group. And I thought, does your senator know you feel this way? After decades of trying and failing, President Obama and Democrats achieved last night was what has eluded a great many who have come before them. There is still work to be done, of course. The Senate still has to pass the fixes to the bill that the House passed last night. That bill that passed last night arrived at the White House just a few hours ago. The president intends to sign that bill tomorrow during a late morning signing ceremony at the Department of the Interior. That bill will then become law, even as it awaits a package of fixes to the bill, a package that has also already passed the House and is expected to pass the Senate by next week. Last week, we speculated about when this bill's key elements would go into effect. Now we have the actual bill. We have the actual language. Now we know. The minute that President Obama signs that bill tomorrow, you can start the clock on a whole list of benefits that come with it. You can start the clock. The minute President Obama signs health reform into law tomorrow, small businesses will begin to get relief from what has been an unpredictable and yet ever-increasing financial burden of providing coverage to their employees. Small businesses can start applying for tax credits to buy health insurance for their employees. Are you a senior citizen? Well, the minute President Obama signs that bill tomorrow, you will start getting help paying for your prescription drugs. That dreaded donut hole that forces way too many seniors to pay way too high out-of-pocket costs for their prescriptions, that dreaded donut hole will finally begin to close. For seniors who already hit the donut hole in their drug coverage in 2010, $250 rebate checks will be on the way to you. The minute President Obama signs that bill tomorrow, Americans who have been deemed uninsurable because of pre-existing conditions, they will finally start getting a path toward health coverage. High-risk pools will be set up for them to purchase the insurance they could never get before. As of June 21st, 90 days after the bill is signed, those high-risk pools will be up and running. The next date to mark down in your calendar, 90 days after that, is September 23rd. As of September 23rd, it will no longer be legal in this country for insurance companies to deny kids coverage because of a pre-existing condition. As of September 23rd, insurance companies will be prohibited from dropping you when you get sick. No more rescissions. As of September 23rd, insurance companies can no longer impose lifetime limits on your benefits. And if you have children, they can stay on your insurance until the age of 26. All of that will happen in just 6 months. But wait, there's more. As of the next calendar year, as of this forthcoming January 1st, insurance companies will be required to spend 80 to 85% of what they take in from you in premiums on actual medical care. And if they don't, they will owe you the difference in the form of a rebate. That same day, Medicare patients will start receiving free preventive care services, no co-payments, free preventive care. Then, after all that, in 2014, it will no longer be legal for insurance companies in this country to deny anyone coverage based on pre-existing conditions. Those who don't have coverage can buy some in the health insurance exchanges that will be fully operational. With lifetime limits on benefits already a thing of the past, in 2014, insurance companies will not be able to impose annual limits on your benefits either. All of those things that I just mentioned, everything there, that whole list, Republicans now say they want to repeal. That's what they're saying they want to run on now. They want to run on a total repeal of that list of things I just described. The gavel had barely dropped on the House vote last night, and Republican members of Congress were already rushing outside to announce their repeal intentions.
Starting tomorrow, we're bringing the repeal of this legislation and getting it filed, and we start a discharge petition, and every Republican will sign it, and some of the Democrats will, and those that don't, you'll know who you need to be looking at in November.
That was Republican Congressman Steve King of Iowa. He was joined last night by fellow repealer, Republican Congresswoman Michelle Bachmann.
We're going to get every Republican to sign it and anybody else. If we get 218 signatures, Nancy Pelosi is forced to bring the repeal bill to the floor for a vote.
True to her word, today Michelle Bachmann introduced this. A one-page bill calling for the total repeal of the Patient Protection and Affordable Care Act. A bill to reinstate the denial of health insurance for people with pre-existing conditions. A bill to reinstate insurance companies' right to drop you when you get sick, even though you've been paying your premiums. A bill to reinstate the Medicare donut hole. Seniors, start cutting those pills in half again. Republicans think you're not paying enough for your drugs. And hey, you 22-year-old on your parents' insurance because of these reforms? Republicans are campaigning to get you kicked off that insurance. This isn't just the Michelle Bachmann and Steve King wing of the Republican Party. Republicans right now, having just lost this major fight, have taken it on as a mainstream campaign point to try to repeal these insurance reforms I just described. Republican Senator Jim DeMint saying, quote, "This bill is unconstitutional and it cannot be fixed. It must be repealed." 2012 Republican presidential hopeful and supposedly mainstream Republican Mitt Romney saying, quote, "The act should be repealed. That campaign begins today." The Republican Party's most recent presidential standard bearer, John McCain, said this.
And the American people are very angry, and they don't like it, and we're gonna try to repeal this.
Senator McCain followed up that pledge with an email to his supporters that said, quote, "I believe we must repeal this bill immediately. If you agree, please open up your wallets." Right next to Mr. McCain's ostensibly principled pledge to repeal health reform is a big green contribute button. He says, quote, "I'm working to repeal the bill. Your immediate donation of $25 or more will enable me to continue fighting." Are Republicans really going to repeal health reform? It appears they would love to. Nobody actually thinks they'll be able to. But will they be able to raise money off the idea of it at least? Oh, yes. Yes, yes, they can. Joining us now is Democratic Congressman Barney Frank of Massachusetts. He is chairman of the House Financial Services Committee. Mr. Chairman, I know it has been a very long few days for you. Thank you so much for joining us tonight.
Oh, I'm glad to do it, Rachel. It's an important time for the country.
President Obama is going to sign this bill tomorrow, but of course the Senate still needs to pass the fixes to the bill that the House passed last night. Do you expect any stumbling blocks in that effort now?
None that can't be overcome. I think I know the Democratic senators are determined to do it. The Republicans are making a very novel argument, namely that majority rule is totalitarian. It's really quite extraordinary. You know, for most of American history, the filibuster was used very rarely, almost always wrongfully, to try and block civil rights. But over the last years, it started to be this new rule that you needed 60 votes to pass something. What they are talking about doing here in the Senate is adopting the principle of majority rule. How that becomes totalitarian is baffling to me. The need for them to try and talk about repeal, I think you made it clear with that really very impressive list of benefits. I have to say, sitting here listening to you, Rachel, when you were saying, wait, there's more, and you talked about all these things, I thought I voted for a set of Ginsu knives. I thought you were going to throw those in right after the donut hole. But the fact is that once the American people experience this bill, once they see that if they like the health care they now have, it will make no difference to them. Those of us, including me, who are on Medicare, we're not going to see any change in this bill unless we hit the donut hole. People who have a good health care plan from their employer or somewhere else, unless they watch TV or read the paper, they won't know what happened. On the other hand, people with pre-existing conditions, let's be very clear. What that means is health insurance companies will no longer be able to say you're too sick to get health insurance, which is what that means. There will be restrictions on what the health insurance companies can do, and we ought to be very clear. What the Republicans are saying is please leave your hands off the health insurance companies. They have an interesting choice of victims. Last week, the Republican leader, John Boehner, went to the American bankers, those poor beleaguered souls, and said, I'm going to protect you from these little punk staffers, who are the people who work on Capitol Hill. So essentially, people ought to understand what they're talking about is protecting the health insurance companies from a set of rules that they don't want to live by.
It's incredible. We got some new reporting just in the past hour, just a few moments ago on Countdown. Lawrence O'Donnell reported that the Senate parliamentarian struck down the first Republican effort to go after the reconciliation bill on procedural terms. Republicans were hoping that the parliamentarian would say that the reconciliation bill was somehow improper. Lawrence O'Donnell again reporting that that effort by the Republicans.
Yeah, by the way, let me explain what it was. Yeah. The reconciliation procedure, which is majority rule, can't be used to change Social Security.